Freetown, Sierra Leone. Sierra Leone has the highest maternal mortality ratio in the world. Thousands of mothers are dying. The leading cause of death during childbirth is catastrophic bleeding, meaning mothers are bleeding to death whilst bringing new life into the world.
We are greatly concerned because we don't want our mothers and babies to die of PPH. So it's our biggest concern and it's one of our biggest challenges, and we want to reduce maternal mortality.
99% of maternal deaths happen in the developing world, but 99% of these are preventable. Catastrophic bleeding is not a direct result of childbirth. However, for a country scarred by civil war, Ebola, and extreme poverty, fast access to sufficient healthcare is a luxury many are denied, resulting in a prolonged labour and increasing a mother's risk of catastrophic bleeding during childbirth.
I think that there are a tremendous lack of infrastructure post-war. And then just when they were getting to the point where they had some progress in the country after the war, I mean, a lot of NGOs came in, the WHO and UNICEF and World Vision and many, many, many others. And then just when they, I think, were beginning to really recover from that post-war environment, Ebola. And I don't blame any of the, we had friends that died, from Ebola because they were healthcare providers here serving, and it was so complicated and so difficult, and so many of the NGOs pulled out.
This is a referral hospital. They either come in late by themselves, or the duration it will take them to move from their primary centers to here is usually could be very long. Transportation issue with financing to move from where they were, the primary health centers, to here.
Most of the women do deliver in the communities with the TBAs, the CHWs, and other nurses in the community. Especially for us, we have the slum. We have the slum down there. So most of them don't come. They will stay there. These health workers will encourage them to give back down there.
Why do you think the mums aren't choosing to use the maternity facility here?
Well, since they are living in the community, they have befriended them. Some stay together with the CHWs. They cajole them to deliver with them.
Why are they encouraging them when their health risks are high?
Some are their relatives.
Relatives to them, neighbors.
And what sort of risk does that put the mum in? What things could she face if she gives birth in the community?
Postpartum hemorrhage, sepsis, because they don't have the instruments that we use here. They don't use sterilized instruments, and at times they even do the delivery barehanded.
In the UK, we are given an injection of oxytocin after childbirth, which helps prevent postpartum hemorrhage. But oxytocin must be refrigerated. For a country with poor infrastructure, reliable access to electricity is not realistic. In 2015, the World Health Organization had approved the use of a drug to treat and prevent postpartum hemorrhage. Misoprostol is temperature stable, easy to administer, and a dosage costs less than a first-class postage stamp. But the government of Sierra Leone does not supply misoprostol to its hospitals. In fact, the only supplier is a tiny charity from the UK, Life for African Mothers.
For instance, the PPH. If we have our cytotech, our misoprostol, then we can counteract the bleeding, and that patient can survive. It's important for us to have this stock for the reduction of maternal mortality.
If Sierra Leone is to see a reduction of the high maternal mortality ratio in the near future, significant effort must be taken to improve access to quality healthcare. How can it change?
Well, one, we will need increased workforce, health workforce. The health workforce needs to be more motivated, and we'll need equipment, drugs, and the general population needs to be more aware about the need for them to get very frequent contact with their health workers the moment they are pregnant.
I notice a lack of urgency there's kind of a lack of urgency, and I'm not really sure where that comes from. I'm still working on understanding that completely. But there's also this sense I hear people say sometimes, like, oh, it was God's will. Well, I think that there are things that we can do in our power to make a difference. I don't think it's always God's will that women die.
In the meantime, it's apparent that efforts should be made to support and sustain the supply of life-saving misoprostol, so mothers across Sierra Leone are not bleeding to death at the cost of a postage stamp.